They tell us coronavirus is a great level. It's not. It's much, much harder if you are poor. How do we stop at making social inequality even greater? Hello, good evening. The language around COVID 19 has sometimes felt tried and misleading. You do not survive illness through fortitude and strength of character, wherever the Prime Minister colleagues will tell us. And the disease is not a great level. The consequences of which everyone, rich or poor, suffers the same is a myth that needs debunking. Those hanging on the front line right now, bus drivers and shop stackers, nurses, care home workers, hospital staff, and shopkeepers are disproportionately the lower paid members of our workforce. They are more likely to catch the disease because they are more exposed. Those who live in tower blocks and small flats, they found in lockdown tougher. Those in manual jobs will be unable to work from home. This is a health issue with huge ramifications for social welfare, and it's a welfare issue with huge ramifications for public health. Tonight, as France goes into recession and the World Trade Organization warns the pandemic could provoke the deepest economic downturn of our lifetimes, we ask what kind of social settlement might we need to be pushed in place to stop the inequality becoming even more stark? One of the hardest things about dealing in graphs and numbers, statistics, targets, flattening or rising curves is the propensity to forget the names and lives behind the growing death toll. Tonight, we want to remember some of those who died while doing their job. They were not soldiers, they didn't sign up to a career in which they pledged to give their lives. They would not see themselves as heroes but as ordinary members of the public doing their job at a time when it was demanded immense courage and kindness. Good night.